inside of your psych meds packet, this area right here has a select all that apply right inside of it. It is always on your exam one way or another. It's so valuable to just highlight what I tell you. So let's go. First of all, the medications in the top are all your traditional, typical antipsychotics. So if you look up there, it says APMs. Do you see that? That means antipsychotic medication, APMs. Y'all good? If you look at the bottom, these are the second generation atypical antipsychotics. And what we told you was this was the medications that give you less EPS. That was the whole point of the newer ones. They give you less EPS. Now, in the middle box with all this typewritten kind of stuff, it talks about the troublesome side effects, and you got to flow with your girl because I'm going to go fast. It talks about the troublesome side effects. The next sentence talks about these are newer serotonin, dopamine, blah, blah, blah. The next sentence talks about these drugs are chosen over first generation. And then we get closer to your select all. It says, in addition, the AAPMs, which is your atypicals, have superior efficacy for therapeutically treating the other symptoms of schizophrenia. Look at those words. They all begin with the letter A. Are you with me? Those are called your negative symptoms. And believe me, you're going to remember that because if you think it through, A before a word means without. Negative sounds like without as well. These are your negative symptoms. Now, your negative symptoms may not mean anything to you in terms of, I don't know what those fucking words mean, but don't worry, I got your back. So you got to do your girl a favor. You see this box or either this box, I don't care which one. Let's quickly define each one. So put your alogia, your anergia, your abolition, your apathy, blah, blah, blah. Okay, let's quickly define them. If you see, it says that A before a word means without, then look at this, because I got to get you good at doing what really helps you pass this test. Look at this word. This A means without. Now let's just play a little bit with it. You don't know it from Adam and Eve's house cat. You never seen this shit before in your life. But let's just try to figure it out. L-O-G-I. What are you thinking? Without what? Logic. Nothing is making sense. So you can figure these out. Okay? So alogia. Your patient is not logical. Without logic. They're not making any sense. Nothing is making sense. So this works on those symptoms because you do have schizophrenia patients where nothing they say is making sense. Okay? All right, guys. So let's look at the next one. Anergia. What does it look like it means?
Without energy.
Without energy. Ergia, energy, right? A-N or A before a word means without. Without any energy. Your patient has no energy. They're just so tired. They can't get out of bed. They don't want to sign up and do a gym class. No energy. Okay? This one might be a little bit more difficult.
And that one's on Inflex.
Huh?
That one's on Inflex.
This one? Mm-hmm. Oh, yeah. Yeah, we've seen this on there. We've seen them all on there. These are select alls a lot of times or part of a case study.
Evolution.
Abolition. This one's harder, you know. Just know that it means without motivation. Without motivation. Here's another one. Apathy without feeling. So you remember the word neuropathy? You have neuropathy, right? Numbness, tingling. Apathy is no feeling. So you have the inability to understand someone else's feelings. You ain't, what do we used to say back in the day? I feel for you, baby. No, this patient ain't feeling for you. They don't give a fuck about your feelings. They don't have the ability to care about your feelings. Does that make sense? It's not their fault. It's part of the psychiatric condition. Okay? Okay, that's schizophrenia, remember. Now, this word affect. I'll put it up here. Here, this means without emotion. She has a flat affect. Flat face. No emotion. Monotone. Affect. A flat affect. Without emotion. She's not going to show love. Nothing. Okay? Flat affect. Now, these are some of these symptoms, just for the record, you will see in autism as well, because we call autism juvenile schizophrenia. Okay? All right? You must know that. Okay? Now, so let's go ahead and go to the next one for these babies. If you look at the next page, what I like about this page, and again, pictures speak 1,000 words. What I like about this page, oh, this is another example. You may appreciate this now that you know your stuff. Do you remember the girl I told you said she had the damn question 3 times? And she had studied her pink packets till she couldn't do it no more? There it is again. Do you see it? What am I saying? Rare. So she saw it 2 different places. She saw it on this packet, pink. She saw it on this packet, pink. That's why every day you must look at something pink. Every day you must look at something pink. You gotta know your pink. It's right from the test, okay? So if you look here in this little box, ironically, it even talks about some of the side effects we talked about earlier with the can't see, can't shift, can't pee, can't whatever. And then you see the neuroleptic malignant syndrome is rare, and then you have the list of the EPS. But one of the things I also wanted to tell you is you can see one of the things that have been on your tests before. I want you to highlight it. Tourette's. Everybody see it? Tourette's. Tourette's, yes. Tourette's syndrome is a condition that Haldol can treat. Now, I gave you 2 Haldol handouts because I wanted you to know this drug. Okay, baby? So turn the page. Turn to the other Haldol handout. First of all, I want to remind you that you must go to this test and know the category of this drug. This is an antipsychotic. I want you to highlight that. It's an antipsychotic. The one that we use Haldol for the most, where it's not given to the patient every day, but we shoot your ass up with it when you're acting crazy, is right here. Acute psychosis. You absolutely need to know that. So maybe you don't have schizophrenia, but you brought your punk ass in here after slipping mollies and doing some crystal meth, and now you wilding the fuck out. We're gonna shoot you in the ass with Haldol. Promise you. So it's not necessarily 100% of schizophrenic patients, right, y'all? It can be you wilding out. Shit, you done came up in here crazy. Okay? And we don't know what your problem is now. We ain't known you but 15 seconds, but we can see right now somebody gonna die. We allow you to keep on clowning. So we're gonna shoot your little ass on up with some Haldol and sit your ass down. So this is what I mean by psychosis. Also, you had to know severe agitation. And when you get this one, because the test's gonna check your ass in a minute, when you see that severe agitation, make sure you know on this test, except for dementia patients. That does not apply to the senior citizen. No way. Now, this page is very interesting because everything on it has been on the test, but it has not been for this drug, because it goes to show you that this drug, and please highlight it, is an antipsychotic. That's true. So you should be on the next page because we moving. This drug is an antipsychotic, but everything on the page but the drug itself is very often on your test for the category of antipsychotics. It may give you Seroquel, it may give you Abilify, it may give you Geodine, but it's definitely going to take from the page to see if you know that everything on this page is related to any antipsychotic. So let's look. Let's really pay attention to the page since that's true. First of all, you have had hiccups on your test. For what treats hiccups? Antipsychotic. You have had these children on your test for allowed to get an antipsychotic. You have had severe nausea and vomiting. We can use an antipsychotic for that. We already talked about mania in the bipolar patient. Remember, y'all? And then we talked about schizophrenia. But peep this. I told you this page got everything you ever want to know about antipsychotics. If you look in the lower right-hand corner, there's that agranulocytosis. There's that sunburn. If you look on the left side, there's all the EPS symptoms. Y'all see where I'm going? Everything on this page is on that test one time or another. There is in the middle your anticholinergic signs and symptoms. So literally everything we've said up until this point is on one page. Everybody see it? It's amazing. You might want to put a little star on that